We have joining us as public affairs analyst, Mr. Offiong Otu, to provide further insights on the ongoing strike. The strike has been called off by the National Association of Nigerian Nurses and Midwives. Akbarawa Offiong Otu, you're welcome on the news on ADBN TV. Thank you for joining us.
Thank you very much. You're welcome.
Well, this is supposed to be real swift, but then the phenomenon around strikes in Nigeria is not new, and the conversation has always been about how this can, be brought to a halt. But it's as if every day we're having different associations, different work arms of the government embarking on strike. Can you bring us some insight to what this really spells for a country like Nigeria, where we're supposed to be experiencing some stability at this time?
I don't know why it is. I am really, thank you very much for the opportunity given me to throw my take into the whole issue. It's just unfortunate that Nigeria in the 21st century should be experiencing strike from wherever, from whichever angle. I heard of this strike by the Nigerian nurses. The federal government shouldn't be waiting until strike comes before they delve into this issue, because these are issues that warnings have been given, maybe roundtable discussions and stuff like that. But you discover that the federal government, the state government, whichever, they keep mum and they wait until the beans is spilled before they come. Everybody will start, the paramount rulers, the traditional rulers, they will come in to weigh in on the nurses or the doctors or the engineers, wherever. It's very unfortunate, because even when they strike for one, it's just like the police going on strike. If the police go on strike, I think they did it in 2004 or thereabouts. I can remember in this state, the criminals almost chew all the raw goat. So that 1 minute the nurses, the 1 day, the 1 week they go on strike. How many persons they have hampered? No, a lot of persons who had issues, very delicate issues, especially those on ICU, intensive care units in hospitals. It's unfortunate.
Well, the health minister, Ali Pate, says the strike has been called off after they must have reached some level of agreement with the National Association for
Nigerian Nurses.
But this is also what we see, roundtable discussions, agreements that end up not being implemented. And you recall clearly that the striking nurses had said that if their demands are not met, they are going to go on a 21-day strike, after which it could be indefinite. How would you suggest the federal government takes these demands as seriously as it should?
Honestly, they should know the value of human life. Let's start from there. If we know that human life is very, very important, if Boko Haram is not killing us, they should not allow us, our brothers, our sisters, our mothers, our children to die. They should not allow. If they have made an agreement is agreement. They should not renege on these agreements. Let them make haste. The kind of money that federal government is spending on frivolous activities and events should be channeled to these other arms. There's no need for you to build a state-of-the-art hospital. 5-star this and 5-star that, and then you are not equipping them, you are not training the manpower, you are not paying them the remunerations that you had promised. If there is an agreement now, if the nurses have agreed to call off the strike and wait for 21 days and thereafter indefinite, they should not allow that gap at all. The federal government should, whatever they have agreed on the roundtable discussion with the nurses, should be implemented.
Thank you very much, public affairs analyst Akbarawa Offiong Otu, for speaking with us.
Thank you very much. You're welcome.
Thank you very much.
Thank you.